went through a very, very long labor, and I had an awesome labor and delivery nurse, and she actually inspired me to become a nurse. I actually went back after I had my daughter, and I went and thanked her for everything she did, because I was a teenager at the time, and she didn't treat me any different, and a lot of other staff, medical staff, did. I hope that I instilled some of her practice in how I treat my patients, because I try not to, I mean, we get all walks of life, right? We get all age groups, all ethnicities, all homeless people, incarcerated people, and I don't treat one person different than the other. And I try to advocate and give the best care I can to every patient, because that's what they deserve. And so I feel that, you know, how she treated me back then, I hope that she's proud that I continued her practice. Before I started school, my mom was diagnosed with cancer. She was at basically the end of the last 6 months of her life. And I've been waiting to get into nursing school, so I knew she would want me to go to nursing school, so I did. But when she passed away, it just was hard. So yeah. So I didn't make it through one of the semesters, and I had to retake it. She died when I was 26. So I just feel like so much of the time I could have had with her was taken. And we were told, you know, right off the bat when she was diagnosed, she had hours to live. So it was kind of like we never knew at any time, even though we got 5 years, which was wonderful, but at any time we could have lost her. So it was hard to, I enjoyed the time I had with her, but you're living on, you know, eggshells, because you never know when she's going to die. I'm on 1 North, which is, it's kind of a combo of all my passions. So it has medical patients as well as surgical patients. It has cardiac patients, and then it has oncology patients. It's kind of like a recipe, right? So each patient has their chemo and certain lab criteria that they have to meet in order to get chemo. This is our memorial wall that we've made to represent all of our patients that have been here on this unit, with the butterflies and this quote here. And then around the corner we have this plaque that the patients can ring the bell 3 times, and then they read this to all of us as we line the halls with the administration staff and all the nurses, and we celebrate our patients' wins.
1, 2, good job.
Different patients affect us differently, and when it's a set-in case or someone that's super young, we do have what's called the RISE program, and it's different nurses from different departments, and they can come in. We all come together, and it's just like a debriefing. Also, every November at Sutter Health Park, we do, it's called Light the Night, and it's the National Leukemia and Lymphoma run this, but we as Kaiser, since we're at the Center of Excellence for Northern California with our specialty in leukemia and lymphoma, we go there and we walk. Sometimes our patients join us, a lot of times the families join us, and we get family members of patients that have passed, and we have their pictures posted, and it's just a nice way to all come together outside of work. In July, my father passed away with mesothelioma, which is a type of lung cancer, basically. And he actually was diagnosed at my hospital and came multiple times to my floor. Initially, it was hard to go back, but I can remember every room he was in. Room 3 is where he was first diagnosed, and he was still very well then. He was walking around, he was eating, and pretty much his normal self. And so I had a lot of memories in that room. We played cards. I came and had dinner with him every night. This is the room where my dad was when he was first diagnosed with cancer. Every time I come in this room, especially when I'm over there by the computer, I just strongly sense him in this room and feel close to him. The other day I went to One south, which is where he was when he went home on hospice. And that one, he was in room 18. And that's the first time I've seen that room since. And that was a little hard. That's where I sat many a times when I talked to my father's oncologist and got some very bad news and had to process it out there, and then as well as having to call my siblings to pass on the news that I just received. So there's a lot of memories out there for sure. It just makes you realize how precious life is and that you really need to embrace and enjoy every day that you have.